Feline CaliciVirus infection. The occurrence is worldwide. It's present in cat breeding facilities, catteries, or wherever there's a high population density of cats that have close contact. The etiology of the disease, the feline calicivirus is a part of the vesivirus genus, which is part of CaliciViridae. There is one serotype with different virulence variants, and they have different tissue tropisms. For the epidemiology, 20 to 30% of cats are lifelong shedders. FIV facilitates lifelong shedding. Lifelong shedding, there's persisting infection in the tonsils and nasopharyngeal mucosa. The virus is mainly shed in saliva, but it can also be shed in the feces and the urine. The infection occurs from direct transmission, such as a mother licking her kittens or cats playing or grooming each other. It's a very resistant virus because it's non-enveloped. It's resistant in the environment. The hosts are Felidae, marine mammals, and dogs. For the pathogenesis, the virus enters the body through the oral nasal route. So an oral nasal infection leads to primary replication in the pharynx, which then leads to viremia, and then secondary replication happens in the mouth, then the lungs, and then the joints. In the mouth, we can see mucous membrane degeneration and inflammation, and in the lungs, we can see alveolitis and interstitial pneumonia, and in the joints, we can see infection of the synovial membrane. In very virulent strains, the viremia can cause infection in visceral organs. For the clinical signs are different according to the tissue tropism and the virulence variant. They can experience fever, anorexia, and lethargy. The main symptoms are in the mouth and pads, the respiratory and conjunctival membranes, and lameness. In the mouth and pads, we can see vesicles and erosions, such as ulcers, on the margin of the tongue, the lips, and the buccal cavity, and on the pads of the paws. For the respiratory system and conjunctiva, we can see sneezing, nasal discharge, lacrimation, and coughing. We can also see dyspnea and conjunctivitis. Pneumonia is rare and it only occurs with secondary bacterial infection. For the lameness, it causes limping kitten syndrome. So the kittens are sore and they can't stand their legs, so they're hopping from one leg to the other. This is immune complex mediated. We can also see enlarged joints as a part of synovitis. In very virulent strains, which affects kittens, we can see very severe systemic infection, such as fever, respiratory signs, and icterus. The systemic infection includes vasculitis, erosion, perihepatitis, and pericarditis. There can be a 30 to 70% mortality. There is a link between chronic stomatitis and feline calicivirus infection and lymphoplasmacytic stomatitis and gingivitis complex. The etiology is unknown, but feline calicivirus are shedders. For the pathology, we can see erosions on the margin of the tongue, and in very virulent strains, we can see vasculitis and pericarditis. For the diagnosis, we can do a swab of the saliva or nasal discharge, and then we can see with using real-time PCR or ELISA the virus. For prevention and treatment, you need to have good hygiene of the catteries and whenever there's a high population density of cats. It's also important to identify the shedders. There is an attenuated and inactivated vaccine. It's usually bivalent, so it can be given for feline calicivirus and feline herpes virus. The vaccine is given at 9 weeks and then at 12 and 16 weeks. However, the inactivated vaccine doesn't stop shedders